Have you ever felt like you needed popped right between the shoulder blades? That spot where your bra strap sits just feels tight all the time? This is probably the most common area, a common complaint that we see in the office, and almost every patient that I've ever seen has had some sort of tension in that spot. There can be a lot of reasons for this, but one of them is just lifestyle. We spend a lot of time here typing, reading, texting, and that can cause some of these muscles to be overworked and some of them to be underworked. So we want to address those. When you first come into our office, we're going to take a thorough history and go through a full exam to see exactly what it is that's causing this pain, and then we're going to go address that based off what we found on that exam. Generally, we're going to do a chiropractic adjustment or a gentle mobilization depending on what you're ready for, and that's going to be in the mid-back, right in that spot where you feel it, and any area up or down the chain that we see that needs some movement. A lot of times those joints just get restricted through the motions that they were designed for, and that can cause a lot of issues with tight muscles and tension and pain. Then we're going to go back and treat the soft tissue that can be associated with this as well. Usually for a spot like this, I'm going to use my hands and we'll go up under the shoulder blade and work those muscles out. We'll work all the way up and down the spine to make sure that we calm those down and open up some of the range of motion that we might have been lacking. Then we have to go and add some exercises to make sure that this stuff doesn't come back. Let's go ahead and take a look at what we would do there. For pain in the mid-back, after we've gotten our adjustment and soft tissue done, we're going to start by opening up the range that we have in these joints with something called seated tide. There's going to be 3 different positions with this, and the first one is focused more on the low back. We're going to go all the way forward and all the way back, thinking of our pelvis like a bowl of water. We want to pour some out in the front, pour some out in the back, and you're really moving the entire spine with this, but you're focusing mostly on the low back. We're going to do 5 in this position. Then we're going to move it more up to the mid-back and really think of keeping your head in the same position. Drive the chest forward, drive the chest back and forth. Just like this for 5 reps. Then we're going to go chest up to the ceiling, chest down to the floor. Your arms will come up and over, all the way up, and all the way down for 5 reps. And this one can be done between 1 and 3 times a day. We really want to think of this like flossing your teeth for your spine. It's something that you can do daily, and it'll really just help to open up that flexion and extension that we need in that mid-back. Now, after we've opened up the range a little bit more, we're going to do something called a wall slide. You want to try to keep your back all the way through your low back, plastered to that wall as well as you can. Elbows and wrists are going to go on the wall like this, and you want to try to keep those stuck on the wall as we raise them all the way up above and all the way back down. If you're dealing with mid-back tightness, this can be a really difficult movement, but it's going to add strength to those upper traps, to the lower and middle traps as we keep ourselves plastered to the wall. And you're going to do this for between 5 and 10 reps for a couple sets. Now, those are a couple of the general exercises we use for that mid-back pain, but it really depends on you. Everything is tailored to you depending on what we find on your exam. So go ahead and get on the schedule so we can find out why you're having this pain and take care of those issues.